Welcome back to another episode of the Easewell Podcast. I'm Dr. Mayor Cara, and today we have an expert in a very exciting topic, ketamine therapy. Dr. Ben Cohen's with us to talk about this new, it's not too new, but it's really becoming a little more mainstream these days, and we're really excited to hear about it. So, Mr. Cohen, Dr. Cohen, sorry, how are you doing today?
Mayor, thanks for having me, man. I'm excited. For those that don't know, we actually were in school together, so
yes,
very excited to kind of bring full circle here. Expert is a very strong word. I appreciate the vote of confidence there. But yeah, it is exciting. It's a good point that you made that it seems like, why are we just hearing about this now? Why is ketamine becoming more mainstream? Because it has been used for, hundreds of years, right? It's been around for a long time. It's been an anesthetic for a while. It's been used for surgery. It's been used for PTSD for soldiers coming back from Vietnam. So there's been a lot of ketamine use in the past, but just more recently in the past, let's say 50 years is when they've really seen it start to help on more of a depression and mood disorder level there.
So since the 70s, it's been picking up steam in this country or around the world, would you say?
I would say it's definitely picking up around the world. There's a lot of great studies in the UK and things going on around the world. But America, we like to take our time on things and,
we do.
Put our regulations on a lot of things too.
Yep.
So it is picking up more steam in America now, definitely in terms of the US. As with most, let's say, alternative approaches to healing, the West Coast has been a little more on top of it than the East Coast, I would say.
For sure. With mushroom therapy being, when we heard about that, 2016, 2017, and ketamine therapy it's very effective from what I hear. I don't know much about it. That's why you're here. You're gonna dive us into the deep end on this. But let's begin with what kind of conditions do people seek this kind of therapy out for?
Yeah, so the number one thing that ketamine kind of like hangs its hat on for in terms of mood protocol versus, and I'm kind of separating the two from how we're treating mood disorders versus what we're using it in emergency rooms and for surgery and for more typical anesthetic, just out cold.
Right.
But in terms of the mood, the number one thing will be definitely depression. Depression takes the cake there. Major depressive disorder, treatment-resistant depression, things where people haven't gotten the results that they wanted. Ketamine has been an amazing tool to help with those things.
And it happens pretty much instantaneously after one or two sessions?
It can. And just to kind of preface with it, just like any SSRI or something that you're taking like an antidepressant, that has maybe a 40% efficacy rate. So ketamine therapy does have like a 60 to 80% efficacy rate. So that still doesn't mean that everyone's going to get better, of course. But it is quickly. Usually after the first day or first treatment, you're starting to feel that uplifting and a better mood. Okay. And with a certain protocol, and if it is for, let's say, major depressive disorder, and you're going through your typical infusions or treatments, you are gonna see those quick results there.
Wow. So I've done a little bit of research on it, and I found that people on the SSRIs, it takes years, decades, and people stay on it. I was actually watching Theo Vaughn, and he had something about this as well, and explaining his journey. He said he's been on an antidepressant 20 years ago, and is still doing the exact same dosage, still on it. Tried ketamine therapy, and it completely changed his life. So yeah, it works really fast.
I like what Theo said too. I saw his interview. Yeah, and he said, "Why am I still on this?" Right? Yeah. I had a problem 20 years ago. Would I wear a cast on my leg if I broke my leg? Right?
Boom.
Like so, it's that same thing. And also, one big thing that can be a problem with these SSRIs are the side effects. Right? There's a ton of side effects. It's hard to even find the right dosage for you, and if you get to a high enough dosage, you're taking that risk of bringing in a slew of side effects too, which makes some people turned off to it as a whole and say, I want to avoid these altogether. Yeah. I will take my depression and my problems to not have to deal with this crap that I'm dealing with too now.
Yeah, I mean, you're solving one problem and adding on three others, right?
Absolutely.
So that's the issue with the pharmaceuticals that have traditionally been used. legality of this stuff. Let's talk about that real quick, because I thought personally it was illegal for a long time. Maybe it is. I know in the operating room it's a different story, but using it as therapy now, obviously there's more research that's being done, and it's what is it? Level
Class
3,
yeah.
class 3 narcotic.
Level 3, yep.
Okay.
Yep. So it's class 3 there. So it depends how you're using it. So in terms of the FDA approval, the two things that have been approved when it comes to ketamine, if we're talking about IV therapy, meaning you're getting an IV infusion of ketamine, that has been approved FDA for surgery, for anesthetic. But it has not been approved for therapy and for behavioral issues. So you kind of say, so how are you able to do it, right? Yeah. So the way that you're able to use it is it's considered off-label, the same way that many drugs are used off-label. Like people who use beta blockers, which would be a heart medication, beta blockers can help with anxiety. Right. So they might be prescribed beta blockers to help with anxiety, but even though that's not what it's approved for. Okay. Because when you get a drug approved by the FDA, it is, I'm using this drug to do this. Yeah. And it has to be, very, and then you have to have the research, very specific. Yeah. Right. But that doesn't mean that clinicians aren't using it all over the world for other issues there. Totally. And that's when it becomes off label, which basically means it won't be covered by insurance. Okay. So in terms of ketamine therapy, the IV therapy can be used off label to help with all of these mood disorders, even though you're not using it to put someone out for surgery. Gotcha. Okay. Now, then you have the other side, the recreational use, which is when it gets very scary, right? And in terms of, obviously, it is illegal to be used recreationally. It has to be prescribed, or not prescribed, but has to be administered by your doctor or by your provider. So when someone gets ketamine, let's say illegally, and they're kind of doing it on their own, whether they're snorting it at a concert or a festival or something like that, you're just taking the risk of hoping you get the dosage right. Yeah. And you're not going to get those profound effects that you would see with a provider administering it, something more in a clinical setting. And dosage is everything. You can microdose this sort of stuff. You could overdose it. We recently heard the unfortunate news about Matthew Perry. Of course. Ketamine therapy. I don't know the ins and outs of it, but I believe he may have overdosed. Is that right? Absolutely. And it's a tragedy, right? Who doesn't love Matthew Perry and Friends, right? But anyone who knows Matthew Perry knows it was a shame because he's dealt with addiction his entire life, whether it's drugs or alcohol. So I would not say that Matthew Perry used ketamine as ketamine therapy. I would 100%. Say he used the drug to help him, try and cope and feel better. He self-diagnosed maybe and self-dosed. Yes. And so from what I've researched and heard about Matthew Perry's case is that he obtained ketamine legally and illegally. Legally being not necessarily ethically, but he had doctors that would give him ketamine. Right. And he also had dealers that would get him ketamine illegally too. Okay. He would kind of give himself injections. He would have his assistants give him injections. And anything at too high a dose, I mean, we're talking a sedative here. So anything at too high of dose will knock you out, right? Or kill you. And so he was doing that. He was, the amount that he was taking was very sad to hear. And he was doing it in a hot tub. And when he sedated himself into unconscious and then he ended up drowning, it's a very unfortunate circumstance. Right. And of course, it set a very tough and negative cloud over ketamine providers who are trying to help tons of people with depression, suicide, ideation, anxiety, PTSD. It was a big hit for them. Right. Doing them the right way. I mean, there's always going to be bad actors here and there, but it's good to know the pros and the cons of all the things. And ketamine therapy, if you do too much, it could hurt you, but you need to be guided. And Dr. Cohen has this. You do have a team that takes care of people during this process, correct? Absolutely. And so there are many, even in Atlanta here, there are a lot of providers who have ketamine clinics set up. Okay. I know they're in Smyrna, Sandy Springs, Roswell. The one personally that I work with, her name's Kathleen. She's unbelievable. She's has a practice called Luna Mindfulness. And again, when she's not there, she's in the ER helping with anesthesia and, doing the actual stuff when she's not doing helping people with ketamine there. So you do want to make sure that if you are doing it, you're with someone who knows the ins and outs, who can help you. So by no means am I a ketamine provider. I have just seen unbelievable results for myself and people in my close circle. And I want to make sure that people know that it's an option.
Right.
I'm not pushing that everyone should now go out and get a ketamine infusion, but you need to know if you are trying, if you are dealing with this depression, anxiety, PTSD, suicide thoughts, then there are options out there to help you. And I just don't want people to think that, well, I've tried everything. I'm stuck. I guess I'm screwed.
No, totally. And what I've also heard is ketamine has become increasingly popular for people with resistant mood disorders. They've tried everything, and for years, for decades, they try ketamine once, twice, and it completely changes their neuroplasticity, basically rewires their brains, and they can confront those PTSD issues, those things that they've been bottling in for many, many years. And it just allows them to confront those issues and become better. Is that right?
Absolutely. And I think if we want to take a minute to go onto the chemical side of it and what it actually does to your brain, which is why it's so cool, because it's completely different than SSRIs, which work on the monoamines in the brain, which would be your norepinephrine, your dopamine, serotonin, these type of pathways in the brain. Ketamine is completely different. It goes after a different area of the brain and different receptors, which are the glutamate receptors.
Okay.
So glutamate receptors, and we're not going to go like too in the weeds, but on very high level, glutamate receptors, when they are overstimulated, they show a very high correlation with overstimulation of glutamate receptors leading to depression and anxiety.
Okay.
So what ketamine does by working on these receptors, it inhibits and blocks those glutamate receptors so they can calm down.
Wow.
And also, it's very cool. I mean, there's a lot that they're learning and knowing now about ketamine, and there's a lot that they don't know but love the awe side of it. But they're also seeing that it is, in terms of neuroplasticity, and for those who don't know, neuroplasticity is your brain's ability to kind of mold and change and not be so rigid. And you see in kids where they have tons of neuroplasticity, this is why they can learn a second language so quickly. Right. Versus us when we're all like, can't rigid. Teach an old, very rigid.
Duolingo's not helping too much.
This is not a pitch for them, right? They will not like this podcast. No. But what you see is that it releases, ketamine also has a profound release with this brain-derived neurotrophic factor, the BDNF.
Okay.
And when that is released, it shows a very high neuroplasticity in the brain.
Wow.
So when you get that ketamine and it works on the brain, you see this release, you get the neuroplasticity, you get the blocking the glutamate receptors, helping you kind of calm down these things that are really creating this depression and anxiety.
Wow.
And what they're even seeing is that ketamine is helping break synapses in the brain, these neurons that are maybe a pathway that isn't the best for you. It's there, you've created it because of the stimulus in your life, whether it's a stressful life, whether it's a relationship, your upbringing, whatever it may be. We have this kind of blueprint in our brain that says this is not depression. This is what your brain wants to be like. But over time, with the improper stimulus, those pathways change.
For sure.
And what we're seeing with ketamine therapy is that we are breaking those pathways and they're reconnecting into those kind of the blueprint default where our brain is supposed to function.
Wow.
Now, that doesn't necessarily hold forever. It's kind of like when the cat's away, the mice will play. So what it does, it helps kind of get rid of the cat for a minute, let the mice kind of do what they want to do, be playful, be active. And then in time, when the cat comes back and sees the mice have created this new, civilization, they might want to be like, we're going back to the old ways.
Right.
Which is why if you've had depression or, treatment-resistant depression, it helps kind of combat that a little bit. Wow. And if it starts to go backwards and you see you're starting to kind of relapse or go back in, you can always get back into another ketamine protocol and kind of maintain that there.
So what would you say the average life of the effectiveness of this would be on an average patient? If they did it one time, how long would this last, and would they need to do it over and over again, or what's your take on that?
Great question. Yeah. It all depends, right? So first of all, it depends on a lot of factors about yourself, how you are with treatments and drugs like this, which may be very helpful.
Right.
But usually I would say if you just did one treatment, you might feel good for a few days.
Okay.
So it's not a one and done type of thing if you're dealing with serious depressive disorders there. But let's say a typical treatment plan for someone who's fighting treatment-resistant depression, it might be 2 ketamine infusions per week for 3 weeks.
Okay.
So in that 6 infusions over 3 weeks, yes, they will feel good for an amount of time. Then they'll get another infusion. They'll feel good for an amount of time. But what they're also seeing is after those few weeks, we're seeing signs of durability where it's actually now holding longer.
Right.
And that durability sometimes lasts weeks, months, or years. So it's very interesting. And again, it's all, case dependent, depends on the person. But it's very interesting that when you stick to the correct protocol, which will be, figured out by your clinician,
right.
you're seeing effects lasting much longer with very few side effects, if any. And it's just up and up.
Wow. I mean, it's for people that's on SSRIs, and that's a majority of the population in this country. This is a very viable option that you should probably seek out. Given that there's very minimal side effects involved, is there an addiction situation with this as well? Can people get addicted to this kind of therapy?
Good question. And there is, right? It can be addictive. It can be habit forming, but we're seeing the addiction and the habit forming more when it's recreational use.
Right. They don't have anybody to help them dose this sort of stuff.
Exactly. And also you're not going deep enough because we kind of have to explain the difference between the high you get by taking ketamine recreationally versus the therapeutic effects of, let's say, a 40, 50-minute infusion or an IV, which takes you to a different place.
Right.
Because ketamine really takes you, we need to find where that dosage is because you're not taking the dosage you would take for surgery, of course.
Right.
Let's say you have sober, awake, fine, and then you have anesthesia and you're out cold. You can't feel if someone pinched you as hard as they could.
Right.
What the ketamine therapy dosage is, it wants you in the middle there, in that dream-like kind of state where you might start to have some visions, maybe some hallucinations, some dissociation from your body, because technically ketamine is a dissociative anesthetic.
I heard that a good bit. Yeah,
absolutely. So it's going to help you dissociate from your body, which means a feeling of uplifting, maybe kind of feeling separate from your body and just very light.
Wow.
But with that, you won't get to that level by doing it on your own. Let's say if you just did a bump or did a quick snort or something,
right.
You might get that high feeling and wow, it feels cool. I'm going into a K-hole, right?
Yeah, I've heard that terminology.
Absolutely. But you're not necessarily going to the level and the sustained level where you would be with a monitored IV with the proper rate and dosage there too.
Makes sense. That's really interesting. Let's talk about a little bit of, we talked about side effects. No really negative side effects to this. What is the sort of dosage that we're looking at versus, well, sorry, let's rewind here a little bit. There's IV therapy and there's also for the therapy, therapeutic doses here. We have IV therapy and we also have nasal. Is that correct?
You have, in terms of from a clinical setting, IV, usually intramuscular, which would be more like an injection, which would look like a vaccine or a shot. And then you have the nasal. So, and there are also oral, there's other ways you can do it. So those aren't the only ones, but those are usually the 3 main ways that you're doing it.
Okay.
When it comes to nasal spray, and I'm not sure if you've heard of Spravato. Spravato is the only FDA approved use of ketamine outside of anesthesia. Now, how did they do this, right? Because we just said that it's not FDA regulated or just not FDA approved. So what they did was there's 2 pieces to the ketamine molecule. There's an R and an S side of it, basically a right and a left hand. Spravato, which was Johnson & Johnson, took the time and put billions of dollars into it, and they took the chemical and they took the S out of it. So now you have the R side, or excuse me, they have the S side and they took the R side out of it. So it's not as effective as the full, the full band up there. It's kind of, you have the lead singer and he's doing his thing up there.
Okay.
So with that, they've created a nasal spray, which can be used for depression disorders. And you go to a clinician, they do the nasal spray for you and you leave. So it's not like you're going home with your bottle of Afrin and you're doing your own thing.
Okay.
So it's still very regulated there. What they're showing is, they were able to get it regulated, which was great. It helped the ketamine, kind of the story, get the name out there. But it's not as affected as when you use the entire molecule, the R and the S side together there. So which you would do in a clinical setting with the intramuscular intravenous. Exactly.
Gotcha.
So, but they were able to do it because it all comes down to money at the end of the day, right?
Yeah. And it's a different compound. I mean, you can liken it to what's going on right now with THC, THCA, stuff
Delta
like
9,
that.
things like that. Yeah, exactly.
It's just a little bit of organic chemistry, and they're making it happen.
Absolutely.
A little changing up over there.
Now, with that, I will say, though, because why aren't they trying to push ketamine to become FDA approved? Basically, there's no patent on ketamine. So it would take billions of dollars to push the clinical trials to get this through, to get it FDA approved for no money to be gained there.
Right.
So they're kind of like, no one wants to put up the money, no one wants to put up the funds, because what are they going to get in return other than the glory of it being done? They're still able to use it off-label and get the effects they want, so they don't want to deal with the headache and all that.
That makes total sense. I mean, I think that's going to change here in the next couple years, where hopefully government will help to bolster these types of things and take the cost of these things and push it publicly, making that a healthier population for us in the United States and hopefully around the world, because we influence the whole world.
Absolutely.
We got a lot of beautiful things hopefully unraveling here in the future with the way that we actually take care of depression. So if you, just to kind of like line item things, we have depression, anxiety, addiction, right?
It can help with addiction. Yeah. Alcoholism, a lot of things like that too. It's really amazing for chronic pain as well. And a lot of people don't realize this part, but when someone's in chronic pain, we're talking excruciating pain for days, weeks, months, years, there is a problem in their brain, right? The pain might be gone. What's causing the pain might not be there anymore. But their brain's still telling them they're in pain. Acute pain, very good to have. You touch a hot stove, get your hand off it. We need acute pain.
Right.
Chronic pain means there's something going on with the wiring.
Right.
So what this can do, and what ketamine's done, is it's kind of helped regulate the switches up there too.
Wow.
And now they're able to kind of let the brain calm down and understand what's going on. And people in chronic pain, usually depressed as well.
Very much.
So, I mean, how would you not be? So it does help in terms of chronic pain, like we talked about with suicidal ideation and with those thoughts as well. People have come in with suicide thoughts, and within 45 minutes, they don't want to commit suicide anymore. Like that 45 minutes, that quick. And am I saying that's for everyone? No, of course not. But they are seeing that tons of times where people are just like, you know what? It's going to be okay. Which is amazing.
That is amazing. I mean, people would be on their drugs for decades. I mean, the Theo Von thing that we talked about earlier, 20 years, still taking the same dosage. And now we have this option. It's been around, you said, for 50 years.
At least in terms of like the clinical setting of, helping with more of the mood protocol.
And now in the 2020s, we're now picking up. I mean, was there any kind of push for this 10 years ago?
10 years ago, yes. I think one of the biggest things was around the 60s, because ketamine and PCP have likeness as well in terms of the chemical compound. PCP is much stronger, much, higher dose there. But also there was in the 60s, we had the government fighting, let's say the hippie revolution and free love and drugs and things like that. And ketamine got lumped in with a lot of these drugs and said, like, boom.
Right.
So it kind of shut down a lot of the amazing effects of, let's say, those psychedelics or dissociative anesthetics, which can really help with these mood disorders. It got lumped in. The government was like, we're not dealing with this crap right now.
Yeah.
It's put on your tie and coat and let's get to work, people.
I mean, it's kind of coupled into, I think most people would know what ketamine therapy is by the word, the phrase horse tranquilizer.
Sure.
That's the number one thing that I thought about when I hear ketamine. And I've heard that, as a child, it's a horse tranquilizer. If it's strong enough to put down a horse, it's a little scary situation. But now it's all about the dosage. And that's, and also how the mechanism of putting it into your body, very important.
And something that people don't realize is that ketamine is one of the most used anesthetics for children.
I had no idea.
Yeah, which sounds crazy. You're like, are we putting a horse drink? It's like, no, of course not.
Yeah.
But what's really cool about ketamine versus, let's say, like propofol, like Michael Jackson, they found in his system and things like that. Ketamine is very transient, has a very on-off property. And also, unlike a lot of other anesthetics, which when you're first administer it, your blood pressure goes down, your heart rate decreases, which can be unsafe if not monitored.
Right.
Ketamine has the opposite effect. It actually raises your blood pressure and raises your heart rate initially. Wow. So you're taking out that risk as well. Wow. And if, let's say, someone, which again rarely happens, but let's say someone gave too much ketamine too quickly in the surgery setting and the patient stops breathing because the dosage was too high.
Right.
Ketamine has a very short half-life. And once you stop it, within 20 minutes, you're going to start getting your faculties back.
20 minutes.
20 minutes, you're going to start to see things improving and then keep adding time, an hour after, 2 hours after, which is the same for ketamine therapy as well. When you're done with your infusion, it quickly metabolizes out of your system.
Okay.
So your day isn't ruined, right? You know, like you're not going to be like a zombie for the next 48 hours or anything.
Right.
You can really go on with your day. After a few hours, you're kind of like, all right, I'm back.
Wow.
Have someone help you, maybe drive you home from the clinic, get an Uber, something like that. But yeah, you're not going to be completely zonked for like the rest of your life or anything.
That's really interesting. So on the other side, of the beginning side of this, how do you guys prep the patients? How do patients get prepped for entering this therapy?
Great question. Yeah. And the thing you'll hear a lot when it comes to ketamine therapy and any type of, let's say other like psychedelic therapy, whether it's psilocybin, like mushrooms or MDMA, when they're in the clinical setting, the two things they always talk about is set and setting. You'll hear that a lot, set and setting. Set, what are your intentions? What are you going in trying to accomplish? Setting, are you out in the middle of the woods at a rave, or are you in a very calming clinical setting? Are you with someone who you trust, who you have that comfort with? And it's just going to help not create any harsh experiences there.
Gotcha.
So with that, we want to make sure, and this is something I work with some of my private clients with. We go through a program, I call it Come Trip With Me, which is a nice little play on taking a fun trip there. But it's an acronym, TRIP. So what I do is I help my clients there. We go through a 12-week program.
Okay.
And it's TRIP, T being the truths and the myths around ketamine, just helping with the education portion, right?
What we're covering today.
Congratulations, we've done T today. Yeah, right. But after that, we go into the R, which is the relationships and the reconnection. Are you trying to reconnect with yourself? Do you feel like you're doing all the right things, but you're not seeing the results? Do you have a problem with your parents, with your spouse, with, your boss, and helping with that side of it? The I, which is a really important part, is the integration part. Because you're going to uncover a lot of tools when you're going through your ketamine therapy. And if you don't integrate that and use that to live a healthier life, to take those good, healthy steps, I won't say it's a waste because it's still working on the brain, but you're missing a big piece of it too. And the P is that path forward, right? Beautiful. What do we do now?
Right.
So it's really cool when I see, myself and clients working with this and really not just going in like, let's try it. I heard it'll get me high. Like no one's going into it with that mindset.
Right. Yeah.
It's more about, I'm doing this, I'm interested in this because I have this problem I want to deal with.
I want to be a better person.
I want to be a better person. I've tried every medication and I still want to kill myself.
Right.
I'm still dealing with this major depression and it's hurting my relationships, my job, my finances. I need an answer. Okay, let's hone in on that and let's look for, what we want to accomplish from this. And then the setting is making sure you're with that right provider and you're with someone who, like I said, will be a hand holder and will be there to kind of guide you through and just say, hey, here's what you might expect. If this happens, it's normal. And it just takes the fear out of it, especially when you learn about the truths and the myths surrounding ketamine in the first place. Yeah,
which hopefully we're doing a really good job at covering today. So you guys can get this information and dive into it if you think this would benefit you. Question about after the whole the treatment. What kind of support systems are in place for post-treatment?
That's why I love, especially when it comes to like my clients, I love being part of that support. By no means do I take the place of a good family and friends and your close circle, but also sometimes it's hard to talk to people about these things when there is a negative stigma around it.
Yeah.
It's America. It's hard to even tell someone you're seeing a therapist, let alone like, I'm trying ketamine therapy. They're like, you okay, man? Yeah. We need to talk. So having that support system, having people that understand what you're doing, why you're doing, and to kind of know some steps to help you afterwards is a great thing that everyone needs. I also think that ketamine therapy works best when it's used with psychotherapy. When you have your therapist and they understand ketamine therapy and what it can help with, have them help with the prep side of too. Schedule your therapy session a day or two after your ketamine so you can go and download as well. Oh. I think that's when you see the best balance, is when it's not just, well, I went in, I did, ketamine. It's like, no, you need that support. So I think it's a great point you made to have, and that's that part of that integration and the path forward.
Right.
What do I do now?
Right.
Because the 2 to 3 days after your ketamine therapy is when you have the highest rate of, that antidepressant effect. Mm-hmm. So you want to start, whether it's creating a whole habit or start your journaling, do some yoga, do some meditation, do something that will benefit your brain and your body. So you're not just, well, what's next?
Right.
You want to have that plan, I think, before you go in.
Yeah. The intention, setting the intention for
Absolutely.
Sure. Are there any substances or activities that people need to avoid prior to getting into this? I'm pretty sure they're going to be motivated to finding this therapy, but maybe there's some habits that they're doing. Maybe they're smoking weed all day. Maybe they're an alcoholic. Maybe they're doing something that's detrimental for them that is creating more of these issues. Are there any kind of substances and activities they should withhold from prior to coming in?
Starting on the medication side of things, and then I absolutely want to talk about the habits. But in terms of medication, people think, oh, well, before I do this, do I need to wean off of my current medication? And the answer is no, right? That's between you and your prescribing doctor. If you want to start that way before you go into the ketamine therapy, then that's up to you too.
Sorry to interrupt.
Please.
So if people are on SSRIs, it's okay that they're on it during a session.
Absolutely. Okay. There are some contras, right? Some things that we don't want to be on, or if you're regularly taking Valium, Xanax, these kind of things actually they do not mix well. So we don't want to mess with that.
Okay.
But if it is your Prozac, Zoloft, these kind of things, those SSRIs, as long as you're staying with it, don't change anything the day before. I'm not going to take my Zoloft today because it's like, no. Like keep your blood chemistry the same, and then we can figure out before or after the treatment.
Right. Solid information.
But in terms of the habits, that was a great point. I mean, look, there are always the number one way to help with any type of mood disorder. I know it sounds hard, especially if you are in a hole right now.
Yeah.
But exercise is just the number one way that you can help these things.
Yeah.
And I know when it's hard to even get out of bed, the last thing you want to do is hop on a freaking Peloton, right?
Totally.
So I get that. Someone listening to this might be like, yeah, real nice. Thanks. I'm going to go to the gym tomorrow morning.
Right.
I hear you. But in terms of exercise, I like to change the word exercise to movement.
Yeah.
Right. Just get outside, get some sun, just move around a little bit, because that's going to help boost those monoamines, the dopamine, the serotonin, all these things that you're trying to improve with medication. We have the ability to do ourselves.
Totally. I mean, the sun is the biggest disinfectant. It'll kill all the bad things in your body if you allow it to. Dude, this has been very, very informative. Is there anything else that we should talk about as far as ketamine therapy is involved that I missed?
A little disclaimer, right? All I'll say is, like I kind of mentioned earlier, I'm not saying that everyone needs to go out, run out, and sign up for your first ketamine infusion. If you want to, great. And also, I'm sure my information will be some way. Anyone's always able to reach out to me and ask me questions. I can put you in touch with a provider if that's what you need. But I just want to make sure people know that there are other options, that if you do feel like I've tried everything and it's just not working, don't give up yet. Don't quit. There's so much to live for. There's so much beauty, so much life, and just stay with it. Reach out to us. I mean, there's such amazing resources out there. And if this episode helps one person, we did more than our job.
100%.
So I hope people just don't give up, keep trying. And even if you feel like you've tried everything, maybe you haven't. Maybe you just don't know that there are other ways out there to really help what you're going through.
That's amazing stuff. I mean, what I've learned today is that this ketamine is going to change your brain wiring, the way that you have been seeing things, the way that you've been living your life. Maybe it's so deep down inside of you that you don't know that you have this issue. Give this a shot. If you've tried everything else, give this a shot. It's relatively harmless. It's extremely effective. It is very efficient. And we have the support over here to teach you how to do this before and after the therapy. Dr. Cohen's information is going to be on this podcast and in the information below, most likely. So please reach out to them if anybody knows or feels that this could be an effective treatment for them, or if they have just questions. I'm sure they can answer all these things for you. And this has been a very important podcast because depression affects everybody. Mm-hmm. Anxiety affects everybody. We are the most anxious, I think, generation ever. People have to work multiple jobs. People have to worry about the world. There's wars. There's issues. There's always something to worry about. So let's tackle it the healthiest way and not become, prescription slaves to the prescriptions for the rest of our lives. So very, very insightful, man. Thank you so much for this information.
Thanks for having me. This was great.
Dude, yeah, beautiful time. Ciao.